letting me wardrobe you guys.
Yes, we love you.
Mwah. Bye.
Hi, welcome to the Naked Doctor Show this week. I'm Dr. Tammy.
I'm Lauren.
And I'm Allie.
We have a guest, Allie.
I am. I'm guesting today.
Welcome to the show, Allie.
Welcome to the show,
Thank you,
Allie.
Allie. Glad to be here. Thanks for having me.
So fun. Today's topic is hormones.
Yes.
So we're going to talk about all things hormones.
That's probably the reason why I'm here. Hormones. I like to call them.
Hormones.
It's
I love
very,
that.
Yeah, it's scary.
Thank you for that.
You're
Hormones.
welcome.
Are you feeling hormonal, Allie?
I'm actually pretty good right now. I'm feeling solid. Yeah.
Yeah, well, they say Mercury's in retrograde, so all our hormones are whacked right now. Like,
Don't throw me. I mean, it's, I'm so good right now.
It's like, do you see me?
do you see me? Do you see me?
The lipstick is on point, isn't it? Matches the shoes. Yes.
You know, I think hormones are the one thing that keep us like a little freaked out, and like the men out there just don't get this, right? Because it's like the cycles of the moon, and like you just, as a man, you just gotta love us. You just gotta love us through like the drama and the trauma and all that stuff. We're just hormonal creatures.
We'll keep it interesting.
Yeah, we do.
Exactly. Way to flip that
Keep you
process.
guessing.
You know, I always say that men are like a light switch, and like women are like the cockpit of an airplane. We are so complicated.
Lots of
with
switches.
hormones. Yeah, lots of switches.
And you know, once you get to that cruising altitude,
Yeah,
you know,
right.
these are,
It's all good.
These are great, but
good.
You got to get there first.
Yeah.
Don't get complacent, though, because you know there's still going to be some turbulence somewhere.
You know, we start out really early. We start having hormone imbalances really early. You know, I personally have had like every hormone imbalance that a female can have. So that's why I really like the nerdy science of taking care of people's hormones. And there's so much that people don't know. And it's technical science. It's not just hokey stuff. You know, it's really about helping people balance their hormones in a way that's natural, and it's not. You know, most women, like if they don't feel good, they go to their doctor and when they get birth control pills and Prozac.
Yes.
That's what they're given.
And something for sleep. Sometimes they give something for sleeping.
Xanax or something like that.
Just not good.
No.
Been there. Been there. Before we started filming, I was talking to Tammy. She's been balancing out hormones now for what, 5 years, I think. I was a straight mess. I had a Diet Coke, and I was just a mess. That's gone too. The Diet Coke's gone too. But I think we've decided that as long as your hormones are balanced and you have 3 sizes of clothes in your closet, that's the definition
Small,
of happiness.
medium, large.
Right there. Yeah.
Speaking of clothes, we have fabulous clothes on today.
Yes.
Sky on the Town.
Like that segue?
Yeah, like that
Thank
segue.
you so much for this.
Yes,
Jean.
thank you for like we're styling and like shopping on the rack before she came, and that's awesome. So we get to play a little bit, and I think that's all about being women and playing in that sandbox as we get to be feminine, and we like a little testosterone too. So it's okay to have a little testosterone.
The tiger
on board.
hormone, we
The
call
tiger
that.
hormone. Yep, feel good in your skin, and not to be embarrassed about having an increased libido or sex drive, and feel good in your skin and feel pretty and like your clothes.
I really like. I
who
never
you are.
thought that I would be happy with the testosterone, but recently I started doing the testosterone injections, and that just the energy level that I've experienced is it's phenomenal, and that's the only one thing that I've changed. That's
a little
different.
muscle tone too. That's not a bad thing.
Now you're like a cougar. She's like cougar ready.
Yeah, they're having to slow me down at the gym. I'm throwing the weight down and grunting.
No, what do they call that? Chunking. Hey, they're saying it's time for a little commercial break. So we're going to take a little break, and we're going to be right back with the Naked Doctor.
Thanks.
Dr. Tammy, the Hormone Queen. In my almost 20 years of experience in working with tens of thousands of patients, I found that hormones have everything to do with weight loss. There are fat burning and fat storing hormones, so you have to maximize the fat burning and minimize the fat storing hormones. I've created Dr. Tammy's 21-day metabolic solution, which will help you heal your metabolism and lose weight. Very exciting. So what do we have? We have my daily metabolic support, which is formulated with all the ingredients to help your fat burning hormones work better and to minimize your fat storing hormones. I also have a great whey protein if you need a little bit of a meal replacement or just to help with some of the appetite. Helps with that glucose metabolism because let's face it, sugar storage, insulin, those issues are huge with trying to lose weight. And when you crave sugar, it's just no fun. So you're never hungry when you're doing this. Our Detox Complete helps heal the gut so that your body can absorb all these nutrients, because if you don't heal the gut first, then you're wasting your money on all this stuff. So I wanted to make sure you have all those great amino acids and anti-inflammatories. And one of the things that we found is most people are not overweight, they're inflamed. And so you have to treat the inflammation for you to lose the weight and for it to be sustainable. I also have my secret weapon, which I absolutely love, which is methylated vitamins. This is L-methylfolate, and this helps clear toxins because most people are not only inflamed, but they're toxic. So this helps clear all of that and helps your hormones work better. And then we have a great probiotic. There have been studies that have shown that people who are overweight have different bacteria in their guts than people who are thin. So if you want to be thin, you need the thin bacteria. So this probiotic helps heal the gut, and all of these things together help your metabolism work better and help you lose weight faster. Welcome back to The Naked Doctor. I'm Dr. Tammy.
I'm Lauren.
And I'm Allie.
Hey, Allie today.
Allie!
So much fun. Yay, Allie! And like the next week, we want to have like our clothes lady on because she dressed us today.
Yes.
Clothes lady.
Yeah, in the town in Fayetteville. It's so cool.
Clothes lady Christine.
Yeah, we had fun playing before the show. You know, I think one of the biggest issues, today's the hormone show, one of the biggest issues that people come in is, so we can talk about menopause, right? Because a lot of people have menopause. But everybody says, well, I don't have hot flashes. Well, I've had hot flashes, which are
Yes,
miserable. But
they are.
You know, people say, well, I didn't have hot flashes, so I got through menopause just fine. But one of the main things around perimenopause, which perimenopause can start around the age of 30. Now, we're seeing things moving earlier, so watch out.
Lauren's like the young chick in the group. But everything's kind of moving back. Like girls are starting their periods, like 8 or 9 now.
Really?
And we're seeing, yeah, we're seeing perimenopause like in the 30s and 40s now. And so there's this whole window of like 10 to 20 years before menopause kicks in where you stop sleeping well.
Yes.
Gaining weight.
Yes.
Not feeling, moody, you know, all these things. So like this perimenopause, menopause thing is a real challenge.
And why is that?
Well, I think it's environmental. So we're exposed to hormones
Right.
in our food. You know, I was like behind, and I don't want to like say any names, but I was behind this truck with all these chickens the other day, and they're all breasts. I mean, there's something wrong with that when you're seeing, like, it doesn't even look like a chicken. It's just a big breast, you know?
Right.
So I don't know what they're
Look
doing.
delicious to eat, man.
It did look delicious. I'm kind of thinking chicken for lunch.
Oh,
so.
yeah, me too. Can we make that happen?
Big old breast.
But so really, you think it's environmental?
Absolutely. And then there's all these pesticides, you know, all these glyphosates, like, and I'll probably get like beat up by Monsanto or something, but you know, the people that make Roundup put all these pesticides on our food, and
Yes.
these pesticides act like estrogen, and we call them xenoestrogens, and they affect our food supply as well. So we're getting exposed to all these hormones in all these different ways, and then we wonder why we're gaining weight and why we don't feel good, and we have all these mood imbalances and issues, and it's all fixable. So
So what do we do?
well, you got to do blood work.
Okay.
And you know, it's interesting because you can look at people's body types. So people
Yes,
have
that's
thyroid
interesting. You
issues.
talked about that the other day in the meeting. And
Yeah.
I was
So you
interested
can
in
look at
this.
somebody, and if they're like gaining weight all over, that's usually a thyroid or an insulin issue. If you just got hip issues, like you gain weight in the hips, that's usually an estrogen issue.
It is. Really? I had no idea that the body types that you could tell.
The guys, so we don't want to leave the guys out in this, but
Okay.
you know, guys who have low testosterone, which is very, very common. I see guys in their 20s having low testosterone. So they get to kind of the
belly,
beer
right?
belly. Yeah, they don't have the
The
muscle
dad
tone.
bod.
The dad bod.
The dad bod. Yes.
Yeah, that's it.
Yes. It is it. I mean,
Well, the
It's
people
a
say the
thing.
dad.
It's a thing.
It's a thing.
It's a thing.
Yeah,
It's a thing. Okay, well.
But yeah, but the belly specifically, like the belly pooching out, that's whenever it's the low T.
Yeah.
Yeah. Dad bod might be like an all over kind of like, and the hairy chest, and like that's kind of the dad bod.
Well, it's interesting because when they get low T, it's kind of funny because you start like growing the hair in the ears, the places where you don't want it.
Oh, okay. Yeah. So low T for a man will make the hair grow in the weird places. Because high testosterone for a woman is going to make them grow
like a mustache.
Right. Okay.
Yeah.
Interesting how that works.
Yeah.
Interesting how it's opposite.
Which I have noticed, and not a little too much information, but
Too
I
much.
have noticed just a little bit with the testosterone injection. So
We're going to zoom in on her face.
next week we're going to do the laser treatment.
We're going to
Get ready.
zoom in on Allie's mustache. Let's show the audience Allie's mustache.
That's one thing about check-in
It's
labs.
worth it.
And so that's one of the things that I do differently when I'm managing people's hormones is I check pretty frequently. And so the first year we might check every 3 months, but then after that we kind of get on autopilot a little bit when we kind of see how people are going to convert.
The cruising altitude that we were
Cruising
talking
altitude,
about.
Yeah. So on the whiteboard segment, I'm going to kind of go through the hormones just a little bit and how they convert and kind of show you that we don't want that just static picture that one time. And I don't want to knock other places or other doctors, but a lot of times they just do that one static, here's where you are, here's what you need, and I think that kind of comes from that one dose fits all synthetic hormone replacement. We're not replacing anything because you'd die without your hormones, but
Right.
supplementation with hormones. And so synthetics are much different than bioidenticals because it's so much more complex. We check all the levels and, adrenals, thyroid, insulin, all that plays an effect. Your brain plays an effect in that too.
It's an orchestra.
Yeah, it's amazing how many problems that people have that really just actually boils down to their hormones being imbalanced and it being diagnosed as this and that. And people never even find the solution to their problem. They get medicated here, they have to take this for that reaction to this medicine, and it's just like a spiraling downfall, when really it was just a hormonal thing to begin
Why
with.
do they give you the antidepressants? I mean, why is it misdiagnosed?
Oh, well, because everybody's afraid of hormones because people automatically think hormones. They automatically think estrogen. They automatically think breast cancer. Doctors are as misinformed as patients are because there was a study done in 2002. It was a big cohort, like 20,000 patients. It was a huge study. And it was really interesting because they were using synthetic estrogen. And there's 3 different kinds of estrogen. I'll go through that on the whiteboard.
Okay, great.
But the problematic estrogen, that's all they were giving was the quote bad estrogen. I don't think God makes a bad hormone, but imbalanced, they were giving a synthetic horse equine Premarin, pregnant mare urine hormone. And they weren't balancing it with progesterone. They weren't looking at people's thyroid. They weren't looking at people's adrenal glands and their feedback hormones with the brain. And they were giving just this unopposed estrogen. And it was causing breast cancer, and it was causing strokes and heart attacks.
I never knew the correlation between where that came from.
Yeah.
So I'm really glad that you spoke to that.
So
on that
people
today.
have hot flashes and they have symptomatic effects of their menopause or perimenopause. And it's just, okay, let's give them a birth control pill, which is the worst thing you can do.
Yes.
Because that's synthetic hormones.
It is.
And then we give them Prozac. And the pharmaceutical companies are very happy. And they make a lot of money.
We don't want that.
I don't want that.
I don't want that. You don't want that.
Yeah. Yeah. It's crazy. And then you don't feel any. I mean, really, in the long term, you can take like those antidepressants for a while, but then, people are chasing their
Well,
tails.
they cause weight gain as well.
Oh, yeah.
I mean, a lot of them have that as a side effect.
Yeah.
But it's like once you're in that hole, it's hard to get out of it, with the antidepressants and stuff, because you're, even coming off of that stuff is like, you get the whole other issue, getting off of antidepressants. And I'm sure even that causes another hormone imbalance, which is, I don't know why people, because how whenever you get off antidepressants and it makes it worse,
The boomerang effect they talk about.
Yeah.
I love too the mind-body connection. I'll get a little like woo-woo here, but I believe that thoughts become emotions, become hormonal chemical imbalances. So the thoughts that people
say that one more time.
Thoughts become emotions or feelings, and then become hormonal chemical changes. So the thoughts that you're thinking can cause those hormonal changes.
Manifesting those problems.
So you got to change your thoughts It's harder to change the emotions in the middle because when you feel something, you're like, I don't know why I feel this. And sometimes you'll even create the thoughts like obsessive thinking that support that emotion because you're like, you wake up and you just feel bad and you're like, so you start looking for all the bad things in your life to support that. And sometimes you're so far on the hormonal chemical change that you can't even think different thoughts. So you start just creating all these circumstances in your life and it's just like this vicious cycle. So dealing with your perceived stress in your life, I think, is really powerful.
It's like being consciously aware of choosing to think about better things, or choosing that if something's bad, trying to find a positive in it or whatever, so it doesn't manifest itself in your body on some hormonal or, it's just, because it does start here.
And the foods that you eat. I mean, I would love to tell you the exercise that you do. I mean, the supplements that you take. I'd love to tell you that, it's all just about hormones because I'm the hormone chick, the hormone queen. Hormone queen. But it's really a whole balance between, and there's so much information and misinformation out there that people don't know. So I think it's really important.
Really complicated.
And you work with coaches who can say, this is what your chemical makeup is. Check blood work. We're all about the nerdy science. And then you focus on what the deficiencies are. And then, you have to exercise. You still have to eat right. But there's ways that you can exercise that don't take that much time. And there's ways that you can eat right that don't take that much time. It's just a flip, just a switch.
Yeah, it really is.
Different way of thinking.
Different way of thinking.
Okay, they're saying it's time again. So we're going to take a little commercial break and we'll be right back with the Naked Doctor.
I was sitting in the doctor's office waiting on him to come in the room, and there's a poster on the door that says, if you can answer 3 of these questions with a yes answer, you most probably need your testosterone tested. So I read the questions and all 8 of them pertain to me. He sent me that afternoon to have blood work done and then got the results. He told me, well, I don't know how you're getting out of your chair. It was so low. And so he started therapy immediately after that, every 2 weeks, and now it's down to once a month, and I just feel like a changed person. The things I used to think about doing, I get them done now. And I mean, you just feel good all day long, and you feel more motivated. Your mind thinks more clearer, and I just really think I feel wonderful. I mean, I feel probably, like I said earlier, 35, 40 years old again. I mean, it's fun to be feeling better. I would tell anyone over the age of 40 to go be tested because the way I feel, it's changed my life.
Hi, I'm Dr. Tammy, the Hormone Queen. In my almost 20 years of experience in working with tens of thousands of patients, I found that hormones have everything to do with weight loss. There are fat burning and fat storing hormones, so you have to maximize the fat burning and minimize the fat storing hormones. I've created Dr. Tammy's 21-day metabolic solution, which will help you heal your metabolism and lose weight. Very exciting. So what do we have? We have my daily metabolic support, which is formulated with all the ingredients to help your fat burning hormones work better and to minimize your fat storing hormones. I also have a great whey protein if you need a little bit of a meal replacement or just to help with some of the appetite. Helps with that glucose metabolism because let's face it, sugar storage, insulin, those issues are huge with trying to lose weight. And when you crave sugar, it's just no fun. So you're never hungry when you're doing this. Our Detox Complete helps heal the gut so that your body can absorb all these nutrients, because if you don't heal the gut first, then you're wasting your money on all this stuff. So I wanted to make sure you have all those great amino acids and anti-inflammatories. And one of the things that we found is most people are not overweight, they're inflamed. And so you have to treat the inflammation for you to lose the weight and for it to be sustainable. I also have my secret weapon, which I absolutely love, which is methylated vitamins. This is L-methylfolate, and this helps clear toxins because most people are not only inflamed, but they're toxic. So this helps clear all of that and helps your hormones work better. And then we have a great probiotic. There have been studies that have shown that people who are overweight have different bacteria in their guts than people who are thin. So if you want to be thin, you need the thin bacteria. So this probiotic helps heal the gut, and all of these things together help your metabolism work better and help you lose weight faster. We're going to do just a little bit of nerdy science on hormones, just a little bit, and I think it's so interesting that cholesterol is actually a hormone that's made by your liver. The majority of your cholesterol is made, and that whole sterol part of cholesterol is what makes your sex steroid hormones, your estrogen, progesterone, and testosterone. And one of the things that happens around the menopause age, or we call it andropause in males, is that we go into our doctors when we're in our 50s or 60s, and the first thing they want to do is check your cholesterol. And that's pretty much the only thing they do, right? In a kind of a health maintenance physical. And so they see your cholesterol is high. And the reason that your cholesterol is high is because your ovaries or your testes are not making the same amount of hormones anymore. Now, your adrenal glands can make all those hormones, but we really start slowing down on those hormones as time kind of ages our ovaries or our testes. So cholesterol then converts into a hormone called progesterone, and progesterone is one of the first hormones that starts to decline during menopause. And I just had a patient, my nurse just asked me a while ago, because I put men on progesterone sometimes, which is mostly thought of as a female hormone because it means progestation. But progesterone affects sleep, and it's a precursor hormone to many other hormones. So progesterone then turns into different estrogens, and everybody's scared of estrogen because they immediately think breast cancer. But if you think about who gets breast cancer, it's usually women when their estrogen is the lowest. Your estrogen's the highest when you're young. Same thing with testosterone. We have this myth that testosterone causes prostate cancer, but you think about who gets prostate cancer, it's elderly men. So we have this total myth that's floating around about hormones, but however, there are different kinds of estrogens, and we call them E1, E2, and E3. And E1, sorry, my 3 is a little wonky there. E1 is actually a more proliferative or problematic estrogen that can stimulate breast tissue. It can also stimulate prostate tissue. And the tricky thing is that estrogen converts into testosterone. So testosterone can actually convert back into estrogen, and men can actually have problems with this E1 as well. So it's really about checking your levels and getting that all balanced. One of the other little side pathways as well that happen in both the ovaries and the testes is we make a hormone called cortisol. And when cortisol is out of balance, if it's too high or too low, if it's too low, you can have problems with inflammation in your body. You can have problems with not handling stress. And when it's too high, you can actually have issues with belly fat. Because what cholesterol actually does is it protects us. So it makes our bellies create fat that's this external fat to protect us from toxins and different kinds of abnormal hormone balances. So all that's stored away from our internal organs to keep us from getting heart disease or kidney disease or diabetes, things like that. So it's actually protective. So you want that whole balance between your cortisol and your female and male hormones. Estrogen is really important for bone density and for helping us feel younger and keeping our skin more toned, and this is both in men and women. We have all the same hormones, just in different amounts and different receptors. Testosterone helps with libido or sexual interest, and progesterone helps with sleep. All major issues that start to decline with hormone balance as we age. So it's really important to get these levels checked. And we mentioned in the other part of the show that because these enzymes, these aromatase enzymes and different things are converting these hormones, that we check them usually about every 3 months when we first start doing hormone balance. And then we check them, maybe once or twice a year, depending on what that picture looks like over time. So we get this picture of keeping you safe, keeping you balanced, and knowing what those levels are over time. So I hope this was helpful to you. I hope you learned something new with all these today. And with the Hormone Show, we just want to educate and empower you as much as possible, because it's not just about taking hormones or filling these gaps, but it's really about your education and empowerment about how these hormones work in your body. So we'll be right back with the Naked Doctor after this commercial break.
I was sitting in the doctor's office waiting on him to come in the room, and there's a poster on the door that says, if you can answer 3 of these questions with a yes answer, you most probably need your testosterone tested. So I read the questions, and all 8 of them pertain to me. He sent me that afternoon to have blood work done, and then got the results. He told me, well, I don't know how you're getting out of your chair. It's so low. And so he started therapy immediately after that, every 2 weeks, and now it's down to once a month, and I just feel like a changed person. the things I used to think about doing, I get them done now. And I mean, you just feel good all day long, and you feel more motivated. Your mind thinks more clearer, and I just really think I feel wonderful. I mean, I feel probably, like I said earlier, 35, 40 years old again. I mean, it's fun to be feeling better. I would tell anyone over the age of 40 to go be tested, because the way I feel, it's changed my life.
We had a great show today. Thank you, Allie, for being on
thanks
our
for
show
having
today.
me so much. It was
fun.
fun.
You're gonna have to be on more often, Allie.
Yes.
I'd love to.
Yes, absolutely.
I love the dynamic of Allie being in here.
It is. It's fun. She's really funny too. She's like a comedian. Like I totally want to see you like.
Well, you know, some of the jokes, it's a 2-drink minimum. You know, a couple of cocktails in, and then.
So let's just talk about that. Red wine is okay. White wine is too much sugar. A little bit of red wine has resveratrol in it.
Yeah.
And she gets really funny after a little red wine.
Yes. Interestingly, I read something recently about white wine is worse for the teeth than red.
Oh, really?
So
Oh, the
yeah,
sugar.
You need to do a
Cavities.
little more
We have a good
research on
dentist
that.
friend who would probably confirm that in our
we
audience
do.
today.
Am I right?
Little shout out to Dr. Box in Fayetteville, wonderful
Absolutely.
dentist. So it's been a super fun show today.
Yes.
It has been.
Yes, hormones don't have
Yes.
to be horrible. They have to be
What'd you say?
horrifying.
What'd you say? Horrible
Yeah.
hormones.
Horrible. So check your levels, and you know if you're really if you want to get informed, we my book Balancing Act, you can go on Amazon and order that. Come in and get your levels checked, because until we check those, we just don't know if that's what it is. And a lot of people have thyroid issues that they don't even know about, so that's
Yes.
super important. Get those levels, a whole panel, not just TSH.
Yes.
Get your whole panel checked, and adrenals, cortisol issues are huge, belly fat, all that's super important. So we'd love to check your hormones and help you manage that stuff. Guys, low T, come get that checked, because life's no fun living with the, what you call it, the dad belly?
dad bod.
The dad bod.
Yeah.
Yeah.
I didn't make it up.
I don't know,
it's
if
out
I were
there.
a guy, I'd rather have the
abs.
And these are the dad bod is not necessarily that you have to be the dad. I mean, it's just a whole look.
Okay, well,
It's sort of.
Well, Allie's into the dad bod, but if you're not, we got you.
These guys.
yeah. So anyway, we want to thank Sky on the Town for these fabulous clothes today and being our
Absolutely.
sponsor today. So thank you so much. We love you so much, and we had a great show. And come get your hormones checked. It's super important. There's anti-aging associated with it. Keeps your telomeres, your DNA young, prevents disease. So it's not just about feeling good and looking good. It's really about disease prevention and taking care of yourself. Self-care, super important. We're moms, we're dads. We take care of everybody else first, but it's time to take care of yourself first at some point, because you can't help anybody else if you're
That's the old
help yourself?
oxygen. The
Yeah,
oxygen
mask on the
analogy
airplane.
of that.
Take care of yourself first, and it's really important. So we love y'all, and we'll see you back here next week on The Naked Doctor.
Thanks for watching.
Thanks for watching.